Assalamualaikum. A very good afternoon to everyone. I am Dayanku Amalina binti Awang Ahmad, and thank you for joining me today. This presentation will focus on the legal and ethical responsibilities in nursing, which nurses carry in daily practice. And using a case study involving a diabetic patient named Miss Lina, this case helped us to understand the implication of malpractice and negligence in nursing. Nursing is widely known for its compassion and trustworthiness. However, it also comes with significant legal and professional obligations. This presentation focuses on the case of Miss Lina, a diabetic patient harmed due to nursing negligence. And the discussion will explore malpractice and negligence and also their legal and professional consequences. Next, I will explain on the case background. Miss Sina is a diabetic patient with foot ulcers needed regular glucose monitoring. Unfortunately, the nurse skipped testing and falsified the result. Miss Lina experienced hypoglycemia and lost consciousness as a result. And this event demonstrates a clear failure in professional and legal duties. Next, I will touch on a legal implication of the nurse action. The nurse breached the professional standards, which is she falsified the documentation. And this is both unethical and potentially criminal. Here we see two major legal issues, which is malpractice and negligence. Malpractice involves harm caused by not meeting medical standards. Meanwhile, negligence is about a failure to provide the expected standard of care. In both cases, the nurse failed to uphold her duty. Next, we move on to the elements of negligence and malpractice. To prove malpractice and negligence, four elements must be shown, which is duty of care, breach of duty, causation, and harm. I will go through one by one on these elements to explain and discuss more and further regarding this case. All right, first is duty of care. The duty of care is a fundamental concept of nursing that states nurses must respond in emergencies and critical circumstances, as stated by Dowie 2017. In Miss Lina's situation, the nurse had a clear duty of care to regularly check and record Miss Lina's blood glucose levels. However, the nurse had failed to do so, which this action could render patient's condition worse and cause major problems, such as hypoglycemia and also lost consciousness. Next is breach of duty. The nurse failure to achieve the legally and professionally needed standard of care in monitoring and recording her blood glucose levels. And the nurse also failed to recognize the seriousness and predictability of hypoglycemia in Miss Lina because she assumed the blood glucose level would stay stable based on the results from the previous day. As stated by Jorgensen and Koilerup 2021, a reasonably skilled nurse would have monitored and avoided the risk by taking preventative measures. Next is causation. A necessary connection between Miss Lina's harm, that is hypoglycemia along with unconsciousness, and the nurse duty violation, which is not properly performing and documenting the blood glucose test. And as stated by Tuton 2009, it is essential to proving liability for negligence or malpractice. And next is harm, which means the actual harm, the damage, or unfavorable result that the patient experiences as a result of the nurse's negligence. And in Miss Nina's case, the patient had hypoglycemia and also loss of consciousness because of the nurse action, which falsified the documented and does not actually taste the blood glucose level. And as stated by Smith 2016, it is essential to establish negligence or malpractice since a lawsuit cannot be successful without evidence of harm. All right, when we want to prove the negligence or malpractice, these four elements must be connecting to each other and also must be related to each other. So in this case, all four will clearly present, making the nurse legally uncountable. Next, I will explain on possible legal consequences. Legal consequences range from disciplinary measures to criminal prosecution. And the Nursing Malaysian Board can investigate and act accordingly. So, first, I will explain on disciplinary action by the Nursing Board. The Nursing Board may take disciplinary action against the involved nurse, which could have major legal consequences, as stated by Smalls 2014. They will conduct a formal investigation after it receives a report. Based on the level of severity of the misconduct, the investigation may result in a written warning, a required remedial education, a temporary suspension of the nurse's license, or even permanent revocation, as stated by Brose 2002. Next is malpractice lawsuit. A civil lawsuit may be brought against the nurse for failing to perform a blood glucose test and for falsifying a normal result. And Ms. Dina or her family may file a lawsuit for damage if it is established that nurse breached her duty of care and that this violation was the direct cause of her hypoglycemia and subsequent unconsciousness. And as stated by Croak 2003, the courts will assess whether the nurse's actions were below the recognized standard of care and whether she directly caused the patient's injury. And next, a criminal charges may be brought if the behavior includes intentional neglect or false documentation or actions that compromise patient safety. And when the patient experiences hypoglycemia and lost consciousness as a result of the nurse's willful documentation of the blood glucose reading without conducting the actual test. And as stated by Guido 2020, the importance of fulfilling professional obligations and the legal requirement that healthcare providers shield patients from preventable harm and highlighted by criminal accountability. Next, I will discuss more on the nurse's responsibilities on patient safety. First is accurate documentation. A nurses must guarantee accurate documentation, which entails documenting clinical data obtained from direct assessment instead of speculation. And as stated by Jeffries et al. 2010, it is the ethical duty of nurses to keep accurate records of the care they give. Next is monitoring patient condition. The nurse had a duty of monitoring Miss Lina's glucose levels regardless of external challenges such as staffing shortages. Miss Lina's hypoglycemia and unconsciousness were preventable if appropriate observations had been made before the consequences occurred. A code of professional conduct for nurses in Malaysia under Section 1.2.1 stated that the nurse must conscientiously assess the physical, psychosocial, and spiritual needs of each patient. Next, I will discuss more on upholding ethical responsibilities, which is advocacy, beneficence. The nurse must advocate for patient safety by making sure there are enough staff and resources. And as stated by Code of Professional Conduct for Nurses in Malaysia, under Section 1.4, the nurse acts to promote and protect the interests of the patient when he is incapable of communicating his needs and protecting himself. The nurse must notify management about these problems so that the patients are safe and professional standards are upheld. Next is the integrity or fidelity. Code of Professional Conduct for Nurses in Malaysia under Section 1.2.1 stated that the nurse is expected to provide a good standard of nursing care by maintaining accurate and proper documentation of care given to each patient. Hence, the nurse assumption that Miss Lina's glucose reading will remain stable without testing and subsequent false documentation represents a failure to uphold fidelity. Next is autonomy. Section 1.1 of the Code of Professional Conduct for Nurses in Malaysia stated that the nurse maintains informed consent in the provision of nursing care to all patients. Hence, patients have the right over what happens to their bodies and care, and this right must be respected by the nurses in giving patients all information they need and encouraging them to be involved in decisions about their care. Next is upholding legal standards. First is compliance with standards of care. According to Section 4.1 of the Nurses Act 1950, Act 14 in Malaysia, all practicing nurses must be registered and are legally bound to uphold the standards of care as prescribed by the Nursing Board Malaysia. Connison et al. 2020 emphasized that upholding care standards is not optional. It is a legal requirement that assures trust, accountability, and safety in nursing care. Next is a reporting and transparency. The Malaysian Nursing Board's 1998 Code of Professional Conduct for Nurses further emphasized the need for nurses to always act honorably, particularly when patient welfare is involved. And furthermore, there's a Malaysia Whistleblower Protection Act 2010, Act 711, which provides legal protection to healthcare professionals who report unsafe practices, which strengthens the legal framework that supports transparency. And also, next is the legal accountability and documentation. Nurses registered under the Nurses Act 1950, Act 14, are legally required to provide care that satisfies established professional standards, including keeping accurate, thorough, and truthful documentation as stated in Section 4.1 of the Act. Furthermore, documentation is a legal record that helps in clinical decision making and is essential proof in the event of audits, investigations, or court cases. In conclusion, Ms. Lina's case reveals the serious consequences of negligence and malpractice, and legal and ethical compliance is non-negotiable in nursing. Hence, nurses must document accurately, act transparently, and advocate for patient safety. And also, reflective practice and integrity uphold the trust and dignity of the nursing profession. In closing, this case teaches us that negligence has real consequences. And by upholding legal, ethical, and professional standards, we protect both our patients and our profession. And this is my references. Thank you for your time, everyone, and stay tuned.